Mark your calendars for Saturday, May 3rd, because CityCast Portland is hosting a block party in downtown Portland's Ankeny Alley in celebration of 503 Day, a totally real holiday. For 5 hours and 3 minutes, we get to celebrate everything we love about living in our great city with live entertainment, food, drinks, and so much more. Like local celebrities doing live band karaoke. Even Dylan T. Pickle has RSVP'd. And then we're going to cap it all off with a live taping of our show, CityCast Portland, the one you're listening to right now. Also, it's totally free. Find more information at our website, portland.citycast.fm. See you there.
Earlier this year, Portland saw an alarming spike in cases of shigellosis, which you will probably recognize by its less specific but historical name, dysentery. The latest statistics show that the spike in infections is subsiding. But why is an illness that's most closely associated with the Oregon Trail popping up in modern-day Portland? And what can we do to eradicate it once and for all? Well, today on CityCast Portland, Oregonian reporter Lillian Mongeau-Hughes joins us to talk about the surprising outbreak, its connection to our growing unsheltered homelessness crisis, and why some well-meaning Portlanders seem to oppose the very simple measures that could help stop its spread. It's Wednesday, April 9th. I'm executive producer John Notarianni in for Claudia Meza, and this is what Portland's talking about. So you've been reporting on this rise of shigellosis cases that we've seen in Oregon over the past year or so, and commonly it's referred to as dysentery, which I think most people kind of think of as a historical relic, right? Like, what is this illness? And it's still here?
Yeah, right. So dysentery is actually sort of a broad term for like terrible diarrhea. And there's a couple different versions of that. Shigella is a bacteria that can cause shigellosis, and that is one form of pretty nasty diarrhea that can be categorized as dysentery. So if you're getting really into the weeds, there's like different strains of this bacteria. One of them is actually called something like dysenterium. Some doctor's going to tell you I said the wrong word, but like that one can cause like bleeding along with everything else and can potentially be deadly. The shigellosis we're talking about that's most prevalent in Multnomah County is rarely deadly, but it can be given certain conditions. More importantly, it's incredibly uncomfortable. It spreads really easily, and it's just definitely not good for you.
And this has been mostly eradicated, right? Like this hasn't been super widespread in recent decades, right?
I mean, it's never been 100% eradicated. The thing that has brought the likelihood of getting shigellosis down significantly in all modern societies, if you will, is having toilets. Yeah. So toilets basically solve this problem. It means that, what words are we allowed to use here? Human waste is rarely found on the ground or in other places where it could be picked up.
You can say poop. This is a poop-friendly zone.
This is a poop-friendly zone. Okay, yeah. So accidentally touching poop or some part of poop and then getting it somehow in your mouth is the most common way of getting this disease. So when I brought this up with an editor, when I started the story, she was like, isn't that like a nursery school thing? Because it used to be that the most common place that this would spread would be, not shockingly in like childcare environments where little kids don't have great sanitary habits. So the reason that the numbers have been so down here and in, across Europe, like everywhere that has toilets, is because there's toilets in modern plumbing. And in places where there's not what we would consider modern plumbing, the cases have continued to be high. It's actually like one of the things that kills small children in countries without sufficient hygiene.
Well, I want to pivot away from speaking of the details of it because it is gross.
Because they're gross.
But we got it out there. I did my job as a journalist. When did we start seeing infections rising here in Multnomah County, and why was that happening?
I mean, Multnomah County does a nice thing where they separate out cases that are apparent in Multnomah County that seem to have originated here as opposed to being somebody visited a foreign country and brought them in, which is really the most common way in America for somebody to have shigellosis is they were somewhere else and got it for all the reasons we just talked about. But if you look at the charts, I mean, things were hovering. In 2017, there were 19 cases in Multnomah County. That doubled in 2018 to 58, came down a little in 2019. But then in 2023 and 2024, it really jumped. And in 2024, there were 158 cases. And these, to be clear, when I'm saying 158 cases, that means they are confirmed by a doctor that did like a test on human waste, on poop, and was like, yes, this is Shigella. That's what's in here. That's what's causing this person to be sick. So it is also true, and I had multiple doctors tell me this, that lots of people get diarrhea and don't go to the doctor. If you find you've had it for several weeks, you might have shigellosis.
I mean, and I think it's worth pointing out, that like part of what experts have been saying about this rise in these infections in our region has been because they've been seeing it with people who have not left, which means that we've been seeing it largely in our unhoused population, right?
Yes, that's right. I mean, I think that it is very hard to stay clean, is what people have pointed out to me if you're living outside. We know that we have around 6,000 people living outside in Multnomah County right now, and those folks do not have access to, toilets and just the regular level of hygiene, even like hand washing stations, all of those things that you take for granted if you live indoors.
Yeah.
And in that population, it's very difficult for people to keep to the level of cleanliness that they often want to keep to themselves. It's just very, very hard to do. Mm-hmm. So the question of how many facilities we're providing sort of that are publicly available for people to use becomes a question when you're talking about the population of people living outside. They are the most heavily affected by Shigella in our community, along with drug users and men who have sex with men, who are also more likely to be exposed to the areas of the body, of each other's bodies, that might give us and spread Shigella.
Yeah. Well, your reporting on this made a pretty big splash when you started writing about this for the Oregonian back at the end of February, I think it was.
It was
saw
kind of
national
crazy.
outlets picking up the story. People, and I think that it had something to do with the headline that said dysentery, parenthesis, yes, dysentery. So that sounds like that was an editor move, huh?
No, that was me. I
That was
I
you,
wrote that
okay.
headline. I'd like full credit. I think it was a great headline.
it caught attention. But now it's early April, and you went and looked at the numbers again, and there are more surprises. What are we looking at today?
Yeah, the numbers have really fallen off. I mean, they're down. I heard from the Multnomah County Health Department that cases were down in February to just 8 cases. That's down from 41 in January and in March 6th. So even taking into account that those numbers are probably bigger in real life than they are in terms of being reported and tested, that's a really significant drop off. The folks I talked to at the health department said, increased outreach and case investigation, which means when somebody is sick, they find out who else they've been in touch with, along with the temporary housing that they've been offering for people who are ill, they think has helped slow the spread. I will also say that if you look year over year, the counts have been going up over time. So I think it is still true that there's an issue, but certainly it's great that the cases have dropped off in the last couple months.
Mm-hmm. Is there seasonality? Like, do we see like swells in these types of infections in the winter like we would with like a flu or something like that?
They do seem to rise in the winter. And I was told by a source who asked not to be quoted and is not a doctor, but who has studied this extensively, that the actual bacteria survives better in like cold, damp places, which is Oregon for 6 months of the year. Though I wouldn't necessarily argue that February was like not cold and damp, and cases did drop off then. So I think there's, possibly that's an element, but I am not the person to say authoritatively that that's what's happening. If you look at the numbers by month, they do rise in the colder, wetter months.
Yeah, well, I want to talk a bit more about the conditions that led to this outbreak in the first place. But first, let's take a quick break. Have you ever walked into a museum and thought to yourself, this place would be way cooler if everything was made of millions of Legos? Well, guess what? Your wish just came true, because Jurassic World by Brickman is now open at the Oregon Museum of Science and Industry. It's a one-of-a-kind exhibition bringing the epic world of Jurassic World to life, featuring 50 massive dinosaurs, props, and scenes, all made from more than 6 million Lego bricks. And it's not just for looking. You can actually get hands-on with interactive activities like Lego brick paleontology, mystery mosaics, island building, and creating your own dinosaur designs. There's 2.5 million Lego bricks at your disposal, so your imagination can run wild. And you can be among the first to see it. This immersive, must-see adventure is making its American debut right here at OMSI. Learn more at omsi.edu. That's omsi.edu.
Ryan Reynolds here from Mint Mobile. I don't know if you knew this, but anyone can get the same premium wireless for $15 a month plan that I've been enjoying. It's not just for celebrities. So do like I did and have one of your assistants switch you to Mint Mobile today. I'm told it's super easy to do at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Even if we are seeing that spike that we saw a couple months ago start to fade away, I mean, clearly the sort of underlying conditions here have not changed, like access to public restrooms and sanitation, just the same as it was 6 months ago.
That's right. There are only a limited number of public toilets in Portland. I think the number I got was just over 100, between 100 and 150. It depends a little bit, what you're counting. So like there's community centers where you can go in and use the restroom, but you can't go in and use those unless you pay a fee. Mm-hmm. And then there's public restrooms in libraries and in day centers that are set up specifically for people who are living outside. And then there are a small handful of porta potties. And then there's the park restrooms, which, as anybody who has a small child or is a runner or is ever outside in Portland parks knows, those are locked for like what seems like most of the year.
Yeah.
So something like, I think 60% of them get locked during the like winter period that stretches for an immense amount of time. So there's just really not like a lot of public toilets available.
Yeah. I think we all learned a lot about that during COVID-19.
Well, that's exactly right. And that's what I was going to say, is that one of the biggest efforts to change that happened during COVID. There were like 123 porta potty toilets put out around the city. Mm-hmm. And what blew my mind looking back at the reporting on that at the time, they were just like torn off of street corners. People were removing them. They were hiding them. Like every single one of those toilets that was put out during the pandemic had some level of damage to it if it wasn't completely destroyed. And the research, like the reporting that was done at the time, and I will give full credit here to Lizzie Acker at the Oregonian who looked into this, the evidence that existed was that most of that damage was done by housed people who did not want that toilet near them, lest unhoused people come and go to the bathroom in the porta potty near their house. So like, I think we just need to be really real in Portland and think about like what we mean when we talk about supporting, hygiene for people who are living outside.
That's outrageous. But yeah, you think about that. That makes sense.
Yeah.
And, Joe homeowner in X neighborhood might see an unhoused person using a porta potty in their neighborhood and feel like it's unsafe or it's unclean. But like, actually, that is a measure that is making a major contribution to public health compared to it not being there.
Potentially, yes, especially if it's combined with a hand washing station. Because I will say, if you use the toilet and then don't wash your hands, that's not super helpful for preventing the spread of Shigella.
Do you know, has there been any conversation at a city level about like the state of public restrooms? I read some statistic about how many public toilets there are available in the city of Portland compared to the number of people. And it's like thousands of people per toilet, It's just nowhere near adequate to be able to cover a community. But like, have there been any more conversations about that?
So, I mean, sort of.
Is it a classic, we should really do something about that?
No, I would say that like Porta Potty Gate really soured people at the city on doing that again. I mean, there were people who work for the city who led that work and literally were doxxed. And like one employee of the city who was like working on this had people show up at their house and like protest and have signs and like all this stuff. I mean, it was really crazy. So those city workers who were promoting this program because they thought it was for the best for the people who were living outside really got the runaround. It took me a long time to even get them to talk to me, and they wouldn't go on the record about it because they're so sort of traumatized by what happened during the pandemic. So in that sense, is anybody talking about doing porta potties again? Not really. That's like probably not on the table. And then I would say there was the classic city, county, like pointing in the other direction situation where I asked them about that.
Move.
Yeah, the county was like, well, the city does it through the parks, and the parks were like, we're broke, we can't do anything else. So anyway, it was a very like everybody pointed at somebody else when I started asking those questions.
My producer, Julia Fiaioni, just came through with the stats. 17 public restrooms per 100,000 citizens is where we're at right now.
It's not a lot of public restrooms.
It's not a lot of public restrooms.
So to be fair, I don't know what that looks like in other cities or how much better it is other places.
Yeah. Do you know, like, first, are other cities dealing with this sort of rise of shigellosis?
Well, this is a great question to which I don't have a great answer. And the reason is I went looking for national data on shigellosis on CDC's website and could not find it. I can't tell you why that data does not exist on federal websites right now, but it doesn't. So there seemed to be some evidence that it used to exist. There was one part where I was like clicking through a circle that kept sending me to different places, and it just, the data it said was going to show up wasn't showing up. So yeah, we will leave the politics of the importance of data out of this
there it
story.
is.
There it is. That happened.
There it
I
is.
don't know. So I really don't know. I did have one reader reach out and tell me that specifically in Seattle, they've done a better job opening and leaving open public toilets year round. And so I've kind of had in my head that I should call Seattle, but I haven't done that.
Well, I mean, for just people in the general population in Portland, how worried should we be about infections like this, either shigellosis or other sort of chronic health issues that are being exacerbated by the fact that we do have a housing crisis in our city right now? And there are a lot of people who are in our community that don't have access to, even some pretty basic healthcare.
Yeah, that's right. It's a good question. I mean, I think the answer is if you're housed, how worried should you be about shigellosis? Not very. Even if you do pick it up somehow, just stay home and use your bathroom until you feel better. Like, it's not COVID. It doesn't spread through the air. It's also like you have to touch it to get it. So it's not like you could walk by somebody and accidentally get shigellosis. I mean, that's just not a thing. I think to me, what was more shocking, and the reason I want to do this story wasn't because this is a massive public health threat to Portlanders in general, but because it shows how difficult it is when you're living outside to stay healthy. And I think that's really important. And the fact that cases have gone up so much in a place that should be a modern city, and yet we're having this ancient disease affecting a significant portion of our population because we don't have the facilities available for them, frankly, to be housed. I mean, if everybody was housed, there wouldn't be this problem. I'm well aware, I report on homelessness in Portland. I'm well aware that waving a magic wand and creating housing for everybody wouldn't even solve the entire problem. Plus, that's not going to happen. So we need to find some interim solution. But I think it's really eye-opening that this old-fashioned, if you will, disease is kind of back on the rise in a place that has modern plumbing.
Yeah. Talking about creating more housing, we've been talking a lot about Mayor Wilson's big proposal, $28 million to try and end unsheltered homelessness, putting more money towards overnight shelters, towards day shelters. I mean, along with all the obvious benefits that something like that provides, I imagine that could help with these sort of issues too, right?
It could. I will say two things about that plan. It doesn't involve actual housing, which you didn't line out when you were explaining what was in his plan, but we transitioned from housing. The $28 million wouldn't cover any actual new housing. And certainly it would be nice for the people who were staying in an overnight shelter to have a bathroom. One of the concerns about setting up these shelters that I've heard from providers is around bathrooms, because if you pick a space that's not built for a significant number of people to use the bathroom, even if nobody's sick, I mean, you've stayed with too many people in a rented house, right? It's not always good if there's not enough bathrooms. So the bathroom part is actually a big question about which spaces will work for overnight shelters and how many people you can put in them. But also, if you're actually sick, you have to go to the bathroom. I talked to one guy who had to go to the bathroom really regularly, on the hour, if not more frequently than that. So being in an overnight shelter where you're up and down, going to that bathroom, potentially you're leaving bacteria in the bathroom too that is now shared. So it's I'm not saying more overnight shelters is a bad idea. I'm not sure it would necessarily significantly reduce the spread of Shigella.
I feel this has been my week of asking questions of guests and being this might help, right? And have them being oh, honey, no, that's not how it's going to work. But
I don't know.
Good job trying.
I mean, there is a proposal also. He would also like there to be more day centers. I think day centers would provide a public place for people to go to the bathroom during the day. That would be good, because if just more people were using the bathroom more frequently, even when they weren't sick, that would help people from getting sick, right? So providing more bathrooms that were open access whenever somebody needed to use them would probably help. All of the medical professionals I talked to said that.
Yeah, I mean, and as you said, even though the bump over the last several months seems to have been going down again, it does feel year over year we are continuing to see this issue come up. So
it will come up again.
Going to come up again.
Yes, it will. I think that's pretty clear.
And it sounds like obviously permanent housing is the end goal and will solve
so many
this
problems
and so many other issues. But the most magic of magic wands, we know that's not going to happen in the immediate short term.
Certainly not tomorrow. Yeah. When I asked the Public Parks Department about just keeping the bathrooms they have open longer, which would go a decent amount of the way towards creating more bathrooms without having to do building, they said that would be very expensive, prohibitively expensive. So I wonder, and I don't know the answer to this, if there's some way to keep them open an extra month on either side, or to have a system where they could be closed in advance of a severe weather warning or something like that, because it doesn't actually freeze overnight in Portland enough to freeze and burst pipes more than a couple times a year. That's kind of where my brain went. I think that the porta potty thing is on its face like a good idea, except that obviously it went very, very bad during COVID. So I don't know what it would do now if people tried that one again.
And that's the most, to me, like the most frustrating part of all of this is that we do have easy, economical, like quickly deployable solutions for things like this, but the public is just too cranky to see them as being positive.
I'm going to say no comment on that. I think there are a lot.
Then I'll say it.
Okay.
Get it together, people. Let the people who are part of your community be a part of your community. Don't stand in the way of things that are going to help people, and wash your damn hands. You know, I see you coming out of the bathroom at the nice restaurant.
I do think everyone should wash their hands. I stand with you on that statement. I feel like as an objective journalist, I can say, please wash your hands.
I see you fine dining patrons of Portland. Even you are guilty of not washing your hands.
Wash your hands.
Wash your hands. Lillian, thank you so much. And yeah, keep us posted. Let us know what the next chapter in this story is once we find it.
Okay, John. Thanks so much. Great to talk to you.
While we were producing this episode, we reached out to the Multnomah County Health Department for their take on this issue. Here's what they had to say. Quote, "The increase in Shigella infections in the Portland metro area over the past few years has been concerning. The good news is that even though the number of confirmed cases was high in January 2025, the number of cases in February and March has been substantially lower. It can be hard to pinpoint the exact reason for rapid rises and falls in Shigella cases like this. Sometimes it's due to the natural changes among people who are susceptible. The Multnomah County Health Department Communicable Disease Services team's efforts to reach out to people, investigate cases, and provide temporary housing are also helping to slow down the spread. We will continue to actively look into new cases and provide support to individuals who test positive for Shigella to prevent further spread of the illness." That's all for today here on CityCast Portland. Thank you so much for listening. If you liked the show, we'd really love it if you told one of your friends about it or left us a rating or a review. We'll be back tomorrow with much more from around the city. Until then, see you at Slim's.